right? I did the SMMTs. Now I'm going to do my special test. The calcaneofibular ligament, okay, right here. So it's responsible, it makes sense, right? It's responsible for preventing inversion. Yeah, see that? How it lengthens, okay? Or it would be tight, okay? So if it's damaged, right, with excessive inversion, okay, some of those, with enough force, fibers may be damaged, sprained, okay? So then what's gonna happen is that you're gonna get way more motion that is supposed to exist there. Does that make sense? Because the fibers are looser, right? You stretched out the rubber band, so now it's gonna go farther, right? Because the fibers aren't as healthy. It's not as tight. Does that make sense? So, unfortunately, I'm trying to reproduce pain, is what I'm trying to do here. So if he rolled his ankle this way, very likely that one of his lateral ligaments is injured, okay? So I'm gonna test the integrity of the ligament, and, let's do it. So the positioning for this, there's gonna be a couple. We're gonna learn the talar tilt, okay? So talar tilt, that name, because you're tilting the talus. Does that make sense? So I'm gonna stabilize here, okay? I'm gonna be on the inside of the body. I'm gonna make my hand to a nice little bowl, yeah? To receive and put on the calcaneus, okay? It's perfect. My forearm,
yeah, who's using all my notes, so.
it's going to be on the bottom, outside. So kind of the bottom and outside of the foot. And then I'm gonna bring him, he's gonna be down. He's not gonna be dorsiflexed. He's gonna be in that neutral plantar flex position. And I'm going to bring him towards myself, okay? So it's like a boom, okay? Just a quick little, no, not too much force, just like that. And you feel that what's stopping you? And you're gonna feel it. Why I can't rotate, his foot a million times is because the ligament is there preventing that motion, okay? So it stops because the ligament is intact. If it wasn't intact, I'd be able to go way further. So, by that logic, okay, it's going to be a positive test, meaning that if it's a positive CF test, calcaneofibular test, if it's positive, that means the CF is injured or damaged. Okay, these ligament tests are positive when, not necessarily when you have pain, that's part of it, but when there's an increased range of motion, when there's too much motion, okay, when it's loose. So this is his normal range, yeah? If it went further, that would be a positive test. I would suspect the CF is injured. But what if he has sprained your ankle before? Have you? Sure, he has a history of it. Most of us do, right? What if maybe he's just, people say double jointed, that doesn't make sense, but can't have. Anyways, what if he just has lax ligaments? Lax meaning loose, right? Already, that's how he's born. He has a lot of range of motion anyways. What could I do to make sure that the excessive range of motion I'm getting is positive? Test bilaterally, compare bilaterally, okay? Because some of us will have loose ankles or whatever. So if both of them have the same amount of motion, yeah, then he's normal to himself, okay? If this one has way more motion than this one, then this one's probably damaged, yeah? So these ligament tests, stability tests, are positive when there's an increased range of motion. Does that make sense? Okay. The really good distinguishment between the two, there's two talar tilt tests, okay? Talar tilt in plantar flexion is the CF, okay? Oh man, I'm really sorry about this, you guys. The CF is in dorsiflexion.
Oh wow.
Yeah, I know. CF is in dorsiflexion. The ATFL, the talofibular ligament, is going to be in plantar flexion. Okay? And you remember that because you see the calcaneus and the fibula here. When you put it in dorsiflexion, they come apart. They're on stretch. right? The origin and insertion have a greater distance between them. The talus and the fibula, when you go into plantar flexion, right, they get longer, right? Because how do you palpate the talus? Remember how to palpate the talus? You can't palpate it when it's in dorsiflexion. You palpate it when it's in plantar flexion, right? So when it's in dorsiflexion, that ATFL ligament is in a shortened position, okay? It's in a lengthened position when it's in plantar flexion. So the talar tilt, you can kind of specify and even get more specific with it. So talar tilt in plantar flexion, it's going to be more ATFL. It's going to get CF as well. But the dorsiflexion one, for the CF, coming this way, yeah, that's mostly going to focus on the CF rather than the ATFL. Does that make sense? Okay? You can also do, we call it anterior drawer, and that's where you just bring it straight up towards you. Okay? And that'll test the stability ligaments too. Some people do anterior drawer, come back on your elbows, and bend your knee. Some people do the anterior drawer like this. We'll come here up, but I don't really like that one. I have more control here. So know that one exists, but I'll test you guys on the talar tilt. So I'll say, please do a talar tilt for the calcaneofibular ligament. You'll know, put him in this position on the table. You're going to come from the inside of the body, stabilize that ankle, right, the tib fib, right, grab the underside, grab hold of it, okay? What did I say, CF? CF, dorsiflex, right, and then bring him into inversion. If I say, please perform a talar tilt for the ATFL, okay, or anterior talofibular ligament, you're going to, same thing, stabilize, and here, but you're going to have them in a plantar flex position, and then rotate towards yourself. Does that make sense? Okay? And then the other one's pretty easy. The deltoid, this one down, it's just going to be, you're going to be on the outside, right? Same thing, you're just going to pull towards yourself. You notice this one has way less movement, right? Way less mobility because of the great stability of the deltoid, right? You get that? It's confusing, I know. I'm using a lot of what?